You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference in how you feel about yourself, how people perceive you, and be a big boost to your self-esteem. According to my first expert, it can change your life. With us, we have New Jersey's cosmetic dentist, Dr. Kelly. Dr. Kelly, welcome to the program.
Thank you, Randy.
Now, good. Now, before we get into today's topic, tell me a little bit about your practice. What are the different procedures you do? Who's the typical patient?
In our office, we see mostly adult patients. We see a lot of mothers who have not been taking care of themselves while raising their children, and now they've decided it's time for me to get what I have been neglecting done. We see patients who have healthy teeth and they want to maintain that. We see patients with very unhealthy teeth that are ready to make that change and go towards health.
Do you hear that, by the way?
I do.
I mean, every day where the patients say, no offense, but I don't like the dentist.
I hate the dentist is the first thing every patient says that to me, Randy.
Interesting.
Absolutely. I hate the dentist. And I say, well, I'm sorry, but...
So you're training after, because we're talking about cosmetic dentistry, after dental school. Tell me a little bit about it.
I continually am learning. And Shawn and I, we go to a lot of... continuing education. We have a study club where a lot of our peers and other dentists and specialists in the area just get together. Everyone has dinner, and we're kind of geeks. We geek out and talk about dentistry and a lecture.
Is there that much to learn, by the way, about creating a beautiful smile?
It is always changing. The technology and what people want and what is almost in style right now matters too.
Okay, interesting. Okay, let's talk about the categories of what you call cosmetic dentistry. At the top of the show, we said small improvements can make a big difference.
Randy, cosmetic dentistry is every part of dentistry. If I'm doing a filling on a second molar in the back of someone's head, I want it to look nice. And my patients laugh at me because when I'm doing a filling, oh, this is so beautiful. And I get excited about my work. And they laugh, and who's going to see it? Well, I'm going to see it, and I care what it looks like. Okay.
Now, you're a dentist. And respectfully, I say that, obviously you probably think that the smile is everything, right? I mean, how important do you think the smile is?
A smile conveys who you are. It's the first way that our body language relates to each other. When you look at someone, you're looking more at their mouth than their eyes almost. And if there's something distracting, say you had a stain on your shirt and you saw me look at it, that would make you feel bad. Imagine the stain is on your tooth and it's always there, and that's what people are going to focus on when they meet you, and not who you are. So it can prevent you from being who you are, or it can enhance that.
Are there people that come in and, I mean, for many years, they confide that they just hate their smile or don't like their smile,
Absolutely.
or they don't smile because of something?
Absolutely. And lip posture can also convey the wrong message. I have a woman in my practice right now, and she is embarrassed of herself. She walks around covering her teeth when she speaks, and we're going to make her a denture, and we're at the final stage, and I'm so excited for her because I know what she's going to feel when she gets that new set and is now able to use those muscles and smile.
So let's begin with the categories of what you call cosmetic dentistry.
Everything we do in dentistry is cosmetic, Randy. Something very simple is bleaching your teeth, whitening. A lot of patients come in.
Most
Absolutely.
popular?
They'll come in and ask for it. And if you're a candidate, it can take you from a smile that is a little bit older looking to something more youthful. I had a patient the other day. He said, my teeth used to be so much whiter. Well, we can take you back there. A whiter smile is a more youthful looking smile. We also do cosmetic bondings. Some patients come in and they may have a tooth that has fractured or a small chip in a front tooth that can really distract from your smile. And in one visit, if we're able, we can bond that back and really maybe if it's pointy on one edge, we can make that round and smooth.
Do people improve their smile, aside from going in for cleanings and problems, but do a lot of people come in because of an occasion, like they're getting married?
Oh yeah, wedding.
They're single for the first time?
That's a very common reason. A lot of women, mothers of the bride herself will come in and I'm getting married and this is a turning point in my life. I want to look my best. And we do that for patients.
Okay, now with whitening, do you do trays? You do something?
There's several kinds. We can do the instant gratification whitening, which is where you come in the office, you leave that day, you're whiter, and we give you those trays to go home that are custom fit.
Okay.
That way they don't hurt your gum tissue, which can happen with a tray that doesn't fit properly. Other way to do it is you come in and you want to whiten, but slowly, and we'll just give you the tray, and you don't have to do the instant day of whitening. And that has a pretty good result either way.
You brought some photos.
I sure did, Randy. I want to show you a couple of things that I've done for some of my patients.
Okay.
This gentleman came to me. He is very young. He's in his 30s.
What is that on that teeth?
What you see on these teeth is something that this patient was born with. This isn't because he doesn't brush his teeth. This isn't because he's a smoker or for any other reason than it was just this way his entire life. This patient felt very self-conscious when he smiled. It bothered him when he was on dates. And he really wanted to do something about it, and he was in a big hurry.
Why is that?
Because it was time. He was ready. People come to a point in their life where now I'm going to take care of myself, and that's when I'm able to step in and help them the best way. This is something that's very commonly seen, the discoloration on teeth.
Like whitening can't take care of it?
Whitening cannot affect this level of discoloration, not one bit.
So what do you do for them?
Take a look at the result, Randy.
Okay, very nice.
These teeth are white now. They are an ideal shape. If you were able to pick teeth out of a catalog, that's what you would want on the top. And if you notice this picture, this is moments after I've put these teeth in, and his smile is forced. He has not smiled in so long. He's just able to show those teeth. Now, I've seen him after this has gone in, big smile. And when you look at him, he's very handsome. He looks much, much different. And now you can really see that, and it's coming out. And we're not done on this case. Now, I want you to look at the lower teeth, Randy.
Okay.
It could be better. And as you age, you do continue to show more and more of your lower teeth. As a youthful smile, you'll show mostly uppers, and then it gradually progresses that way. So we're going to continue his treatment when he's ready and do the same procedure on the lowers.
Now, we talked on the phone. You say that they come in and they're acting differently. I mean, you fix their teeth.
Absolutely.
You can see personality changes.
Yes. I had a woman who had no teeth on the top and broken teeth on the bottom so badly that they were wiggling together in her mouth. And she had her head down. She wouldn't look me in the eye. She would stutter when she spoke. We went through a very simple procedure where we were able to give her a set of dentures, which is something that patients, they feel so lost, but I know how easy it can be to fix these problems.
Are they cosmetic set of dentures? Because I feel like I could spot dentures.
No, this set you would not recognize. I would tell you that a lot of my patients that have dentures, other patients have come because they've been referred and they don't know that that's a denture. They just know it's a beautiful set of teeth.
Good.
A great way to achieve the ideal look and smile is a denture, because I have control of every single tooth and I can put them in the best place for your face.
Okay, so how much of the design of the teeth are you involved?
All the whole process. You can really select a shape that fits a face. A male should have a square tooth. A woman should have a more round tooth, depending on your bone structure, the color of your skin. Where is the middle of my face? Where is the middle of my tooth? All these things go into consideration when we're designing a smile.
Okay, good. Now, for people just tuning in, we're talking to New Jersey's cosmetic dentist, Dr. Kelly here. And she says small improvements to your smile can make a big difference. And it doesn't have to be a full set of veneers.
Absolutely
not. It could be
not.
a small thing from whitening, etc. Take me through the process. Somebody goes to you. They don't like their smile, okay? What do they say? I mean, tell me what a consult goes like.
A lot of patients will come in with something small that really distracts from who they are. Very common complaint is, I have this filling, and when I smile, it shows that my tooth looks very gray. Is that a cavity? And oftentimes, that's just a silver filling in a front tooth area, and it's very easy.
Like that ring,
if you see an outline, sure. Or maybe an old crown that was done years ago, and now the gums have shrunk, and you can see where the crown ends, and that would need a new crown. And one crown can really make a big difference in someone's smile.
What is it? Is that just older technology using
some of it
a metal under the tooth?
Well, we have a way now to make crowns without using metal. The crowns with metal in them have their place, but for a front tooth, I would generally use an all porcelain crown, which they can make some very strong materials comparable to metal, but they look so much better now.
Okay, so for the person that comes in, so they're on the consult, maybe their whole mouth is a mess, but they want a beautiful smile. How do they know what it's going to look like? Tell me what that process is like.
Well, they would know by looking at some other cases or some photos that I have, but it's really more of an idea in their mind and what do they want, and I have to understand what we're both talking about.
What do they say they want? I mean, does everybody just want white, straight teeth?
They usually don't know. They'll say, I have a mouth that's a mess. No one else has a mouth this way. And when I look, I'll say, you know, it's not that bad. And it's not the worst that I've seen. We can fix anything. Let me show you another patient.
Okay.
Here we have a woman that came to me, and her complaint, I hate my denture. And she's talking about the teeth on the top that you see here. And when you look at this case, the first thing that strikes you is probably the bottom teeth. They're crooked. They're not touching each other. They're long, and the top teeth are flat. They're very yellow, and all you see is gums when she smiles. It's not a very attractive smile. It looks old, and it looks unhealthy. The other part about this woman was she was a little bit angry when I met her because she wasn't comfortable in her own skin. She's walking around with a denture that she doesn't like. She's always aware of it. And it carried through into the way her personality was. And I was a little taken aback, to be honest, when I first met her, because I thought,
like, they appear grumpy.
This woman is grumpy. That was the first impression that comes off. Now look at this after, Randy.
Oh, very nice. Okay.
We brightened her up, and I became so fond of this woman. She was one of my favorites, and I miss her because we finished her case.
You laugh when you talk about her. Is it because of her personality?
Absolutely. We shared a lot of stories. She would bring photographs of her children and her grandchildren, and I get to know my patients personally, and it, I think, helps me restore their case better.
Okay, now when we say at the top of the show, you know, that you change a smile, change somebody's life.
Absolutely.
It's like this.
When you see this woman now, she's magnetic. She's glowing, and she's not grumpy anymore, but that's who she really was, and this was stopping her from getting there. And all I did was take the obstacle out of the way.
Okay, we have time for like one more photo. What else are we looking at?
Here's one of my favorites because it was so quick. This gentleman here had a problem with grinding. That tooth, that front tooth, is not chipped. That's because of what he's doing in the middle of the night and stress, or for whatever reason. He had ground that tooth down, and it had been that way for years.
Was he self-conscious about it?
Absolutely. He had a hard time lifting his upper lip up so that we could see that smile. This procedure, look at the result, Randy. This took about 2 hours, and I bonded that directly in my office, and he left. We made him a night guard to protect it so he doesn't grind that away. And his wife told me on the ride home, he would not stop looking at his face in the mirror. She said, my husband won't stop staring at himself in the mirror. Look what you did. And he's so happy. And actually, he's more of a regular patient now that I've done that for him. He was one of the ones who didn't like the dentist, didn't go a lot to take care of himself. And I see him every 6 months.
So the wife says he's looking in the mirror.
Yeah, he won't stop looking at himself. What did you do?
I guess, you know, and we've talked. I mean, cosmetic dentistry is not for everybody. But if you don't like your smile,
sometimes it's a lot easier than you think.
Like a little chip or a space in between the teeth.
Oh, sure.
If it bothers you, what's your answer to that?
Just do something about it. It's usually a lot cheaper than what people think, and a lot easier and faster.
So with all of these patients, though, because we've talked a lot about this, that you say that a lot of people didn't like their smile for 10 years or 5 years.
Absolutely.
So what is it? Their fear of the dentist that keeps them from doing it? Is it the expense?
Patients tell me when they come in, you've never seen a mouth like mine, and they're embarrassed. And yes, I have. You have no idea how common it is that patients have no back teeth.
I mean, this looks bad. I mean, I don't ever see this.
We see that all the time, Randy. I see that on a weekly basis or more. You don't see that because patients that have a mouth that way don't smile. And you may perceive that as they're uncomfortable, they're self-conscious, and they won't show you because you have that ability to talk without showing your lips. But
do you spot it as a dentist? I mean, you're out and about, the grocery store.
I know my friends by their teeth. If you show me this big of a picture, I could tell you who. Yeah, absolutely.
Is that right?
I see it and I can't stop seeing it.
All right, good. Okay, well, now we're going to bring your husband on the show. Tell me about him.
Shawn.
Because you told me something on the phone was great. You said he's brainwashed out. Everybody likes him.
The first thing that attracted me to Shawn was, how come everybody likes him so much? He was in an office, and it was a tough crowd. It was a very busy place. in school, and all the patients would say, I want to see Dr. Shawn. I don't want to see, this doctor. They would all come in asking for him.
Interesting. Okay, we're going to bring him on the show. Well, thank you so much.
Thanks, Randy.
So if you don't like your smile, final message, give
Do
you guys
something
a call.
about it. Call us up. We'll help you out.
All right. We're going to take a quick break. We come back. We're going to speak to her husband, New Jersey dentist that is getting amazing results with his patients. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about how small improvements to your smile can make a big difference. With us, we have cosmetic dentist, Dr. Shawn Kelly. Dr. Kelly, welcome to the program.
Thank you, Randy. It's a pleasure to be here.
Now, before we get into today's topic, and by the way, your wife, great interview, had her on the program. She was bragging about you, and you didn't get to hear what she said, but she said that everybody likes you. So good for you. Good for you.
Thanks. She's some very nice things, and she is a doll. A pleasure to work with, and just a great partner.
So you work together.
We do.
As dentists. And where's
Yes.
your practice, by the way, in New Jersey?
It's in Atco, New Jersey. It's southern New Jersey, just outside of Philadelphia by about a half hour or so.
So what are for people that didn't see the first part, I mean, who's your typical patient and what are the procedures you do? Do you do one thing and she does other things?
Well, we really don't have a typical patient. We have so many different patients that come in with different issues, different problems, and we do all facets of general dentistry.
Okay.
And Dawn and I do a lot of the same, pretty much all of the same procedures, to tell you the truth. So that includes fillings, crowns, veneers, even things like extractions or root canal. We do that as well. Gum work, cleanings. It's a general dental office, so we pretty much do all the facets of general dentistry.
Now, when we say at the top of the show that small improvements to your smile could change your life.
Yes.
Sounds like an exaggeration.
Just doing a small little procedure, maybe fixing a chip on someone's tooth or a whitening procedure, can really change the quality of life. And what I mean by that is they're now smiling, they're feeling better about themselves.
Okay.
They're happier in their life overall, and they're able to be themselves more, that they're not self-conscious about their smiles anymore. For example, I have a patient who came in to me at one point, and she really didn't like the way her front teeth looked.
Okay.
She wasn't happy with the angle of them, the brightness of them, and we just made some small changes with some veneers and some crowns to the front of the smile. That same exact patient ends up the same day walking out of our waiting room when it was done, and she starts flirting with a couple fellows who were actually in the waiting room that day. So it was an instantaneous change, and every time she comes back for her checkups, she says the same thing over and over about how happy she is with her new smile, how much better she feels, and just her quality of life is really improved.
So what are the categories of cosmetic dentistry? And what falls into cosmetic dentistry?
Well, really, the categories of cosmetic dentistry are kind of difficult to put in those categories because we want everything we do to be cosmetic and look as good as it possibly can. But some of the procedures that fall in there, you can start off with simple things such as just recontouring of natural teeth if they have little edges on them that need to be changed, to whitening. You can go to veneers and all the way to the complete smile makeover, if you will. And those things apply in all of those different disciplines. Even when you make a patient a partial denture or a complete denture, it has to be cosmetic. And that's just the way that it needs to be for the patients to get what they're looking for.
How important do you think the smile is, by the way?
It's hugely important.
I mean, you're a dentist. You're going to say that.
Of course. But let's be realistic with it. It is hugely important. It is pretty much the one thing that you can see and everyone can see. And I can't tell you how important it is to our patients too. Every day I have patients who come in and they have their hands over their mouths, or they say that I've probably never seen someone with a condition as bad as theirs. But the reality of it is that it is a very common problem. Many people want to make changes to their smiles, and just a little bit of a change can make a big difference.
Well, I know that, I was researching, smiling and everything, anticipating this interview, and it's at the top of the list as far as attractiveness, they say.
Yes.
Is a nice smile.
Yes.
Interesting.
Yes. And it makes sense because it's framed by your face, and it's really the one thing that people tend to see. A lot of the times people can see a smile, maybe not know why they're attracted to that person or why that person looks good to them. And it could be that the smile is what's doing it. We see that quite often because when we make those little changes in their smile, it ends up that a person feels so much better about themselves. They tell us about how their friends brag about the way they look. They ask what they've had done. They can't really tell what they had done, but they did. And they can tell that there's something different. They just don't know what it is. So it's very subtle.
So do you think it's the fear of the dentist? Because you say there's a lot of people walking around, I guess all over the world, but in Jersey, tens of thousands, that they're not smiling. Their perception is they're mean. And the truth is they don't like their smile. So what holds them back? I mean, what do they say to you on these consults?
The biggest thing
is
the
dentist?
The fear, absolutely, because fear, they don't know what to expect from an appointment at our office, and of course everyone associates dentistry with pain, which is really not the case anymore.
Okay.
And people may have had a bad experience as a child, and they've not seen the dentist for years and years, but it's different. It can be changed. They can come in and realize, and truthfully, some of my best patients are ones who come in and the first thing they say is, "Doc, you've never seen a mouth like mine before." And I get excited because I know immediately I'm able to help that person. And I just kind of have to hold back and let them tell me what they perceive as needing to be done. But I've become very excited about it because I know I can help them.
Okay, let's take a look at, you brought a photo.
I did.
Some photos. Let's take a look at this.
This is a photo of the sister of a coworker that I used to have, and she was about to get married. So she didn't like the way her smile looked. She wanted to get it fixed up. She didn't have a lot of time to do it. So in the period...
Wants to look good in the pictures.
Wants to look great in her pictures.
All right.
So we discussed what some of the options were for her.
Right.
And when it was all said and done, we decided to do some veneers for her, some bondings for her, and a crown. So it really improved upon her smile. She was a very pretty girl. She just didn't like her smile.
Okay.
So after we finished with the treatment, the smile matched what she was. She felt that
very nice.
Matched her face, and she was very happy with it. Look at the before and after. I mean, what do you see with that?
Huge difference. Okay, on the before, she looks younger, like. And the after, she looks more sophisticated, I guess.
Yes. In the before picture, she had some spacing, not uncommon to see in a younger person or even a young kid. Okay. And then later, she looks sophisticated. She's happy. She's smiling, and that's basically really.
Yeah, you know, and we talked. I mean, in this economy, why do something like this?
Oh well, if you have this person and this person right next to each other,
all right, okay.
Same credentials in an interview. One's confident, one's happier, one's smiling, the other one is not. Who do you hire?
That's a good point. It's a good point. Well, she looks even healthier in the after, just because of her teeth. Okay, good. Now, with whitening, how popular is that, by the way?
Very popular. It's really one of the easiest things that can be done to change a smile. And on a daily basis, we have patients who come in and say they're unhappy with the shade of their teeth. And a lot of times, it's just a little bit of whitening really starts a cascade for patients.
What do you mean by that?
Well, they may come in and want to change their smile just a little bit. They're not sure. They're not really ready to commit to a big case. So they start off with something small like some whitening. Makes a big difference.
Okay.
Next thing you know, now they want to have some other cosmetic procedures done. Maybe interested in veneers. Maybe they want to straighten the teeth that were already lightened. Maybe they want to do other areas of the mouth. So really, when you have a positive thing happen and you're happy and you go home or you go out and you see your friends and they say you look great, your smile looks great. Maybe they never heard that before.
Compliments for the first time.
Absolutely.
Interesting.
So when they hear that, they want more. And it's a good feeling. You want to feel good about your smile. You want to smile. You want to be yourself. You don't want to be held back by something you feel is unattractive to other people.
Now, when it's all done and they look at in the mirror for the first time, can it be emotional?
Absolutely. That as a dentist can be one of the most rewarding things that ever happen in a dental office. A patient comes in, say for example, the patient we spoke of about being fearful earlier. That patient comes in. Now, their fear is transferred into happiness.
Okay.
They come in, their appearance is entirely different. They look better. They're happier, they're more confident.
So in this economy, why should somebody fix their smile?
Why shouldn't they? I mean, it's a smile is really what you need, especially in this economy, I feel, because unemployment is up. People are competing against each other for jobs. You want to have every possible edge that you can. You want to feel good.
In this economy, though,
yes.
Why do something to your smile?
Well,
spend the money.
Well, I mean, what better investment than to make it in yourself? Especially something that is going to make you more positive, feel better about yourself, and really can give you an edge on the different things that you need to compete against other people.
Okay.
So if you're going for a job interview, for example, and if you feel better, then you're going to project yourself as a more positive person, a better candidate for that job, and it may give you just the edge that you need.
Okay, good. Final message. Somebody watching this, they don't like their smile. Maybe they haven't liked their smile for years. What do you say to them?
It can be changed. It can be changed. And it doesn't have to be a huge step. It could be something small that starts off, and maybe that's all they need. I mean, cosmetic dentistry isn't for everyone. But for the people that do want to have a better smile, starting off slowly is a great way to go, because it's not the huge involvement of a big case. And then it ends up that once they see a little bit, a small change, that might be all
then they get the bug.
And then they get the bug, and then they want to see the next change, and the next, and the next.
Well, thank you for coming to the show. Great stuff.
Thank you very much.
And if they want to meet with you one-on-one, they go to your website,
yes.
They call your office, and make an appointment with Dr. Shawn or Dr. Dawn.
Absolutely.
All right. Thank you so much. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.